Hello, everyone. Welcome to my Zoom podcast. And today we got a very exciting guest, Dr. Chris Edwards. He's a biologic dentist, and we're going to talk about biologic dentistry today and the importance of keeping your microbiome in your mouth optimized. So welcome, Dr. Chris. How are you today?
It's my pleasure to be here and to share a little bit of what I know with your viewing audience.
Yeah, well, we have talked in person, and you are a wealth of knowledge, and that's why I asked you to be on the call today. So thanks for being here, and thanks for your time. So let's dive into it. For our listeners and viewers today, tell us a little bit more about yourself, especially on how you got into dentistry in general.
All right, well, that story goes back to childhood when I wanted to be a dentist at age 10 to 12 with Dr. Mintz in my hometown who did braces on me and the like. And so I decided I wanted to be a dentist. I was always a tinkerer with my hands.
Yeah.
Well, I like to build things and science projects and fix things, bikes and whatever. So it just sort of seemed to fit. I then changed my mind to become an oceanographer, and I went to Kings Point, Merchant Marine Academy, and found that they really didn't even offer oceanography. But I stuck it out and enjoyed 4 years of being in the Merchant Marine Academy. Got 1 year sailing around the world. But during that year, I realized that I really didn't want to be in the Merchant Marine or an oceanographer, and that I would go back to dentistry. So I unfortunately did not have all the prerequisites. So I went ahead and had to go back to night school and wound up working as a mechanic for the city of New York, fixing bulldozers and then garbage trucks.
There's all that handy stuff
working with my hands and exactly, and taking the necessary courses, and which I completed and successfully got into dental school. And I went to Temple Dental School in Philadelphia.
Yeah.
And that was in the mid 70s that I went there.
So that's actually very interesting because I didn't know that story. But I mentor lots of people, and a lot of people did not find their purpose in life yet. And it's one of those things that I ask them: what were the superpowers you wanted as a child, or what were your dreams about, and who did you want to be? And we get away from those dreams, and so we gotta sometimes search for, again, what is our passion in life, and what makes us get fire in our stomach, and a lot of us gotta get away from that, and we get caught up in things that we're really not passionate about. So your story reminds of it. You knew as a kid what you wanted to do, but you got away from it. But I'm glad you got back into it, because now you obviously excel in the area that you are working in. So let's get started, Dr. Chris. What is biologic dentistry?
Well, let me backtrack just a little bit to go into dentistry. So Temple Dental School back in the 70s was a day of amalgam fillings was the filling du jour. And, we already we started to have porcelain crowns, porcelain baked onto metal, and conventional dentistry. So that's what I was trained in. And I wound up getting a residency program in Honolulu at the Queens Medical Center. And there, I was really fortunate to have worked with the best specialists in the whole Pacific Ocean, and was given a real good view of quality dentistry and the like. And I went to private practice in Hawaii. And I can remember in those days early that there were some patients that came to me who had already had their mercury fillings removed and had plastic fillings put in, and they were all getting decay around them. And at that point, I was convinced that, that it was the wrong thing for that patient. And, and I had to actually twist his arm and put mercury fillings back into his teeth. But, that in that day, that's what, my heart said was the right thing to do. Something that was going to work and was going to last. Because I was trained that there was no problem with mercury fillings, and I actually had a lot of them in my own mouth from childhood.
Yes.
And as time had evolved, I've always been somewhat of a organic kind of guy, more holistic. As a matter of fact, in dental school is when I first learned about organic gardening and had my first organic garden and used a rototiller and and started the importance of eating healthy. And so my whole life I've sort of lived in that vein of realizing how important health was, and I would say that for the first 10 or 15 years, I was doing much more conventional dentistry, and then the word the first of all the resin fillings started becoming more predictable, and could almost last as long as a silver filling.
Yeah.
And so I quickly started learning that, and I learned a lot about cosmetic dentistry, which is also a lot of adhesive dentistry. So using of resins for bonding, whether you're bonding a porcelain onto a tooth or rebuilding a tooth just with resin.
Mm-hmm.
And so I became quite comfortable with resins, and it was at that time that I decided that I would no longer put mercury into children's teeth. I would not be the first person to put mercury in this person's mouth. And yes, I was still doing some on adults for people that couldn't afford to do the crown that they really needed. I had learned to become quite a good mercury dentist, and rebuild a tooth, with lumps of silver. But when I moved to Florida, which was around 2000 or just after 2000, I made a decision that I would no longer use any mercury and head my practice in a more holistic direction.
Yes.
And in the community that I joined, I got involved with a lot of alternative kind of practitioners, and I got myself tested for mercury, and I was at the 99 percentile of mercury. This was with a hair test with somebody that was really, smart. And what that means is that you're excreting mercury, as I come to learn, which is sort of a good thing, but it means that you have it in you. So, and that really changed my journey towards learning more about holistic health and how to get mercury out of the body, which is really not a simple thing.
No,
it's not just as simple as removing your mercury fillings. Is actually removing mercury fillings is dangerous if it's not done properly, because there's more
end up in the system. It ends up in the system, right?
So we've also learned that when you have mercury fillings in your mouth, that it's getting into your body. A lot, no, but just from chewing and certainly grinding of your teeth, which a lot of us world are doing these days. You are releasing mercury, yet our bodies really have the ability to remove toxins. And everybody's bodies are different. Some people are good detoxifiers and some people are not. And depending on how much you're getting and how many other toxins are out there, which, continue to increase in the society that we live in, I went ahead and was guided to do chelation, to start reducing my mercury burden in my body, and learning about that. And that sent me on a journey of learning a lot more about biological dentistry. And, and that's where, I joined the International Academy of Oral and Medical Toxicology, the IAOMT, which is a science-based organization that looks at holistic biologic dentistry. And I would encourage listeners, if you want to learn more, that's a good website to go to. It is also a good place to find a practitioner near you. They have a practitioner database, and you can find somebody near you. And then, of course, then you can go into their website and reviews and all that stuff and see what they offer. And then from there, in the IAOMT, I was introduced to a further learning by becoming a doctor of naturopathy, which is something that is in the state of Florida is not recognized. As a matter of fact, you can lose your license or get locked up for practicing as a naturopath. But in many of the states, including the Western states, you can go to a naturopath as your primary care physician.
Yes.
And there's two levels of naturopaths. There's those that go to a 4-year university and are really trained more than I have a naturopathic degree, that you already have to have a professional degree, and then you go to learn. So I don't really consider myself a naturopath, but more of a dentist with naturopathic training.
Yes, and that's great,
Uh,
of course, because whether you can license or not use that name, you have the knowledge, period. And I think it's great that you just look at the body as a whole and how, the mouth and the teeth and the health and the toxins, have an effect on the entire body. So we talked about the toxins and the mercury. So what if listeners at this point have mercury fillings? What are your thoughts on mercury and even fluoride? And should they get tested or should they replace them? Because you also mentioned that, even with the grinding and even with some of the mercury leaching, that the amounts are not great. So is it worth, changing those fillings? Or what would you recommend for those listening that have mercury fillings? And what are your thoughts on mercury and fluoride?
okay, well, there's a lot of questions there, but
Yes.
let's start with you know, should you get your mercury fillings out or not?
Yes.
And in my own practice, I have a philosophy of letting the patient decide what they want to do. My job is to do a really good, thorough diagnosis, of their mouth, uh, and as a dentist and even as a naturopath, I'm not really qualified to make the decision of whether or not a patient has a toxicity issue. And there, I like to recommend or have them partner with somebody that's in the functional medicine arena. And for those that don't know what functional medicine is, that is a level of looking at the whole person, not the symptom. Similar to what a biological dentist is that they really want to look at all aspects of your health, not just why is something hurting or why is this laboratory wrong or what drug can we give you to correct the symptom that you have. A functional medicine doctor is one that looks to what they call the root cause. If there's a problem, it's like, okay, well, let's peel back the onion and try and figure out, why is this happening? And and then from there, what change can we make that can affect an improvement, not necessarily what pill should we take. And biologic dentistry mirrors that. So my recommendation would be that people that feel like maybe that they are having a problem with the mercury toxicity issue would be to go to a functional medicine practitioner and find somebody that can do the proper testing, and there are tests to look at mercury, and it's not easily tested because mercury gets embedded into the cells, and including the brain, so it's not really so much a worry in the blood, it's really a worry about deep in the body. And so that testing is, the testing that seems to be some of the best today is called the mercury tri test, which looks at blood, urine, and hair, all three at the same instant. And and then sort of with computer algorithm looks at all of those values and tries to come up with where you're at. And also that mercury tri test looks at your organs of elimination, which are both your kidney and your liver, which are ones that have to be in order to be able to remove them. And that's something that's people can be fairly sick with mercury, and they really need to get their body healthy before they can start dumping mercury into whether it's into the colon or into the urine. And also, if you're dumping it into the colon, if you're not putting a binding agent in the colon, guess what? It gets reabsorbed.
Yes.
So you need some sulfur-based binding that is catching it. So it's not something that I would recommend that people do on their own to try and chelate. Okay, I think that it's something that because when you chelate, you remove minerals and you create potential other imbalances in the body, and particularly for somebody that's sick or not feeling well, that can push them over the edge. So hopefully that answers that.
Yes, sure. So if your tests are high, you go to functional doctor, and it seems like you may have symptoms of too much mercury in your body, and the test, kind of shows that that may be the case, then the course of action would be finding somebody that knows about chelation therapy. Make sure you're in an optimal condition. Make sure that he also preventatively gives you the right nutrients that may be depleted because of the chelation, is what I'm hearing. And at the same time, one of the options may go to a biological dentist to then replace those mercury fillings with what?
Well, replacing them safely is the important thing, because there's a protocol that the IAOMT has, and we follow it, that when you actually drill out a mercury filling, you think of all the mercury particles that you might be swallowing as the problem. And the reality is that the problem is actually mercury vapor, that as you're drilling the filling, it creates a vapor, and the vapor goes into the lung, and the vapor is how it gets into the body. So that having been said, when the protocol involves a patient breathing pure oxygen through their nose while we are doing the procedure. Secondly, we use a rubber dam, which sort of surrounds the tooth and captures the majority of the particulate. We use special burrs that try and create less vapor. And we have a vacuum that the patient holds right near their mouth that is taking that vapor out of the building. And plenty of water, and sometimes, if it's really serious, you can actually go ahead and use chlorella and other kind of binding agents at the same time. I don't do that very often, but some patients come aware of it and want it, and that's fine. So, and personally, if a patient is healthy and has a silver filling that's not that big and not decayed or problematic, I give them the option of leaving it. And yet if there's decay or fracture, then the choices are to restore the tooth with a resin filling, which is something that is a composite resin, and today we've got the best resins ever, and some of the resins are actually not even that healthy. Some of the original resins had BPA and less other toxins in
Other toxins,
yeah, exactly. I mean, who said to say that plastic's not toxic, right?
Well, very toxic in my opinion.
And then if the tooth is more broken down and has fractures in it, and unfortunately that's one of the negatives of the mercury fillings, is that commonly we will find fractures in those teeth because the mercury fillings expand and contract with temperature much more than a tooth does, and there's no adhesion to the tooth. They're just basically put in a hole that's wider on the bottom than the top, so they can't fall out. And so commonly we'll find fractures developing in those teeth. And then the proper restoration is usually to cover the top of the tooth with a type of a porcelain restoration, a partial crown or some kind of a crown. And nowadays, we're using all ceramic materials. The previous crowns that we did, and early in my career, I did 1,000 gold crowns, and many of them are still working. But in my training, it turns out that even gold is something that the body is not everybody likes it, and a gold crown in dentistry is not pure gold. It's too soft. So it's an alloy of gold, and so the gold standard is sort of nowadays is really ceramic, which seems to be more biocompatible with the body, and in our office we have a CEREC system, which is a German crown making system where we actually make the crown right in our office. We have a variety of materials that we use, and in one day you walk out with your brand new crown that looks like a natural tooth.
Same day.
So every tooth has to be evaluated on its own merits,
So the key is obviously to have a trained biologic dentist, and it seems like you have many ways to prevent leaching of mercury, whether it's a particle or whether it's gas, during the procedure of removing or replacing the mercury. So that's something I didn't know. So that's obviously some great information. So we're talking about mercury as a toxin. We obviously don't want to replace it with another toxin. So we're talking about the ceramic. When I talk to people about dentistry many times, and even about dentist friends, there's always the discussion of fluoride. So what's your thoughts on fluoride? Of course, in our drinking water, but also, a lot of dentists say we need to use toothpaste with fluoride because it protects the teeth. And I'm not so sure about that. What are your thoughts on fluoride?
Okay, well, I've been on both sides of this debate. As a matter of fact, when I was practicing in Rhode Island for 20 years, I was the president of the Rhode Island, the Newport County Dental Society, and half of our town was not fluoridated because we were buying water from a non-fluoridated source from an adjacent town. And the director of the water supply was his wife was my patient, and he proposed that we get it into the water, and I totally supported it. I thought it was and we got it passed. Unfortunately, in my same complex that I was a chiropractor who was totally against it, and we wrote him off as being a wacko.
Yeah.
He's crazy.
That's what happens to us.
And unfortunately, as I've gone on to become a biological dentist, I realized that he was actually right. And I feel bad for those people that are getting fluoridated water for the last 20-something years that I was somewhat responsible for.
Yeah.
So
why is fluoride? Why should fluoride not be in our toothpaste or in our drinking water then?
Well, fluoride is a very interesting compound. It's actually the most active compound in the whole periodic table of elements. And it's in the halide group, which has got, chlorine, which we know from bleach, kills everything, right? And bromine and iodine are in that same tree on of elements. And fluoride is the strongest of them all. So, for example, if you take fluoride and you put it next to a thyroid hormone, the fluoride will replace the iodine, which is crucial to the hormone working properly. And you might even test that you have the hormone, but maybe yours has got fluoride in it.
Yes.
So fluoride, and it interacts with many enzymatic processes within the body. So if you take fluoride into the body, it interferes with things. And one of the reasons why we in dentistry believe that it is good is that the structure of teeth and bones is what they call hydroxyapatite, which is basically calcium and phosphorus sort of as the building blocks of bone. Well, fluoride will replace the hydroxyl atom in that hydroxyapatite, and now it becomes fluorapatite. So we don't talk much about it, but pretty much all of our bones are loaded with fluorapatite. And, does that make them stronger? Yes. Does it make them more brittle? The jury's out on that, and nobody wants to study it because I think that they would find that
yes,
definitely that leads to easier bone fracture. And, you as a physical therapist, how often are you dealing with patients that have taken not even a minor fall and now have broken their bone and need to be in rehab?
So would you say it's increasing the risk for osteopenia, osteoporosis?
Those are, that's a density thing. So I can't answer that. I don't know that,
Okay.
but it definitely, changes the character of the bone, and there could be a relationship to that. And it's sort of disappointing that, that we have the ability to really look at testing some of these things, but these kind of clinical studies are expensive. And unfortunately, I think that, when they sort of know that the answer is not going to be good, it's best not to research it.
So why, yeah, I agree with you there. So why is the vast majority of dentists out there really pushing this fluoride, are they so convinced that it helps with the teeth then?
Well, that's a good thing. I was convinced in my training that fluoride was, an excellent thing. As a matter of fact, I even had my wife taking fluoride before my first child was born, because there was a study that later turned out to be flawed that showed that pregnant women that were taking fluoride would have the baby teeth would be much more resistant to decay.
Wow.
Okay. And so the way that fluoride works with teeth is that when the tooth is being formed, 2 or 3 or 4 years before it ever shows up in the mouth, is when the fluoride gets incorporated into the tooth. Okay. And that becomes more of a fluorapatite than a hydroxyapatite. And that becomes, a different, a little bit of a different structure. And yes, it is a little bit harder. And yes, it might be a little bit more resistant to decay. The majority of the decay that happens in adolescence is not because the enamel is not hard. It's because the way that the tooth is formed, there's these different lobes that all come together. And if those lobes don't seal perfectly tight, there's a tiniest little gap that a toothbrush can't get down into.
Yeah.
And, that's where, a diet higher in refined carbohydrates, which is, the predominant diet in our country today,
yeah,
that those pits and fissures quickly lead to decay, whether the tooth's fluoridated or not. Okay. After that, fluoridation that's being swallowed in water, for example, has no benefit. As a matter of fact, fluoride is not necessary for any biologic, needs in our body. It is not necessary as an ingredient for our health.
When you just Google it, it starts with saying it's a neurotoxin.
So, well, you know what, and that's what's happened is that we have now learned that it is a neurotoxin. And to be honest with you, if you really peel back the onion and go down the rabbit hole of looking at fluoride, it's used in many processes. One of them is aluminum, making of aluminum. And and during World War II, we ramped up the aluminum production, and the aluminum companies were seeing toxicity of their workers, as well as in the enrichment of the first atom bomb.
Yeah.
There were, fluoride was a big component of enriching uranium. And, and there was actually even some deaths that were somewhat swept under the rug because, we were in a war. And so, I hate this, to sort of be a conspiracy theorist, but the reality
facts
is
are
that,
facts.
that the companies, wound up realized that they had this toxin that they had to manage, and not long before they had discovered, in some areas where there's high fluoride in the water, that it did help with resistance to decay. As a matter of fact, if you have too much fluoride in the water, it makes the tooth ugly. At first you get the white spots on it, but then we call it mottling, fluorosis, and when it gets really bad, it can almost be brown and ugly. And even then, not even and weak. So there was a hypothesis made that, well, if we just put a little bit of fluoride in the water, that this would help. This would help to decrease decay. And we have a decay problem in this country. So let's, so they started doing some science experiments to try and and a lot of this was backed by the scientists of Carnegie Mellon, that was involved with Alcoa, for example, and all of these big chemical companies, wound up supporting this theory, and got themselves involved with the American Dental Association.
It saved them a lot of money,
et cetera. And all of a sudden, this was now considered to be the greatest thing that we've ever done. They started a 10-year study in Grand Rapids in 45, and in 1950 they started fluoridating. I'm not exactly positive on these dates, but
approximately.
they're out there. And even before the 10-year study, they started fluoridating before they really had the final results from the study in.
Yeah, when I did some research and watched some videos and tried to educate myself a while back, I really saw many factories, industries that actually had to put plans in place, and it cost them a lot of money to get rid of fluoride as their waste product. And those people are in hazmat suits, and it was, the biohazard sign on it and things like that. So it seems like it's very convenient that suddenly this fluoride didn't need to be taken care of anymore, and we could just dump it in our water supply.
And unfortunately, that's exactly the truth. And I live here in Florida, where phosphate mining is one of our industries.
Yes.
And at first they were discovering that all of the animals that were grazing downwind of the smokestacks of these plants, because they have to heat up the phosphate rock with fluoride to turn it into the mineral for fertilization, and that the fumes coming out of the smokestacks were killing the animals downwind.
Yeah, no.
So they
Yeah,
decided
and
they would put.
in the vast majority of countries in the world, it's not allowed to have the fluoride in the drinking water.
Right, 97% of the world is not fluoridated, including 97% of Europe. There are a few places in Europe that are fluoridated at this point. But so anyhow, just to finish
Are
the
there
story about
teeth worse than ours, Dr. Chris? Are their teeth
well, you know
worse?
what? That's a really good thing, in that if you do the research, if you study the charts of every country, shows that decay is coming down, 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 and if you were to look at just our chart for our country, you would say, hey, it's working. Look at this, the rates are coming down.
But it's everywhere, even if the water is not fluoridized.
And some of the countries that are non-fluoridated actually have a bigger decrease in the caries rate than us.
Because we're talking about symptoms, right? Again, the cause is not lack of fluoride. The cause is our diets and the way we take care of our health and our mouth.
Right. So yeah, let me just finish a little bit on the fluoride, the phosphate industry.
Sure.
So they put scrubbers in the smokestacks, which capture all of these particulates and stuff before they come out the top of the smokestack, and that's where they have come up with this product called hydrofluorosilicic acid, and that is what the phosphate industry sells to the water departments to be able to put into our water system, yes, with a hazmat suit, because it is quite toxic. And in 1 gallon of this liquid, there's only 1 quart of hydrofluorosilicic acid. The other 3 quarts is this dirty water with other toxins in it. But the good news is that they're at a level that meets the requirements of the EPA, that there is not harmful to humans.
How convenient. I would think toxins accumulate in our body. That's the problem.
Exactly. Well, there's things like arsenic and lead are tested in this, and those are totally banned. But somehow or another, we look the other way and we dump this into our water supply, and I really am an advocate of removing water fluoridation from our country.
Yes. And weren't you successful where you are right now?
Well, recently in the small town of Mims in the northern end of our county, we were successful in getting it out, and we had a referendum that the city council did, and we passed with a lot of resistance from the pro-fluoride lobby, which is mainly organized dentistry.
Yes.
And I have been working hard to try and educate them that maybe they should take a closer look at it.
Yeah.
And certainly the research that continues to come in is now showing neurotoxicity, and the studies are many studies have been done, and originally some of those came from Mexico, and actually they even came from China. So can we believe that? But ultimately, in some areas of China, for example, where they have higher fluoride areas, the IQ is 5 points less.
Yes, significant.
Significant, and right now there is a suit by the EPA in California, where the EPA for the first time is being sued under the Toxic Substances Control Act, TSCA. And that suit has been ongoing for the last 2 years, and COVID sort of threw a monkey wrench into it.
Sure.
And I listened to a lot of the hearings, and the science is in the favor of not doing it.
Yes.
And the judge is sort of in a tight place, and they're going to revisit the new information that's come out since this all started. But
it's a process,
ultimately,
but
it could be coming down. And of course, if this toxin wins against the EPA, that opens the door up to many other people saying, this shouldn't be in our drinking water. I mean, you and I are both aware of the number of toxins
yes.
that we as Americans are subjected to. I read something the other day that in the cosmetic industry, there are like 10, ingredients that are approved in Europe, and we have like 200 that are allowed. All these different ingredients that you're not allowed to put into a European cosmetic process that we're smearing all over our skin.
Yes.
Yet, and these toxins are getting into our body, and so it's not just fluoride or mercury. It's really a toxic world that we're subjecting our bodies to, and unfortunately the food, the food is, this glyphosate is a toxin that I'm really worried about, and for that reason, we actually had a neighbor offer us cinnamon buns to say today. And when we found out it wasn't made with organic flour, with glyphosate flour, plus loaded with sugar, we passed, my wife and I, I love a good taste of a good cinnamon bun. Trust me.
Sure. We are obviously more and more exposed with this information age, technology-driven age. We don't live in pristine areas anymore. So yes, we are bombarded more and more with toxins. And there are certain things that we can do to mitigate a lot of them, but we can't just run away from them if we want to live in cities and towns. But there's many, many things that we can do. I wrote a book on electromagnetic frequencies and radiations, many things we can do there. Today, we're talking about mercury and fluoride, things that we can do. Of course, water filtration systems to try to keep them out. It would be better in the long run that those things are not in our drinking water, of course. And I applaud people like yourself that really are advocates and doing the work and putting in the time to try to keep those toxins out of our water. So let's, for the last part of our podcast here, let's shift a little bit of gears and let's talk about how important the microbiome of our mouth really is.
Well, that's one of my passions, is the microbiome, actually, and I'm fascinated with it because, I read a book in my naturopathic training where it was a book called The Second Brain. And, and this is written by an MD, and it really opened my eyes to the fact that the immune system really surrounds our gut, and the immune system is related closely to what's living in our gut. And when we look at the start of the gut, where is it? The lips. Yeah. So everything inside of the lips is technically the gut. And there's microbiomes everywhere. They estimate that there's 70 trillion cells in the body, 700 trillion microorganisms living in our hair, in our ears, on our eyes, certainly in our sinuses and in our nose, in our mouth, on our teeth, under our gums, in our throats, and all the way down the tube, and
that microbiome influences how we think. It influences our immune response. And, so having a healthy microbiome is job number one to health, because if you don't have a healthy microbiome, you can't be healthy.
Yep.
And inflammation is probably one of the killers in today's society, the things that get us and weaken us, and eventually we'll get pneumonia or whatever that might be the final straw that broke the camel's back. But inflammation is one of the most important things to try and minimize in your journey of health. And again, that's where a functional medicine person can help you look at that. So the microbiome in the mouth, though, is really important in that if you have a healthy microbiome in your mouth, you don't need fluoride, because decay is a result of acid attack in the teeth. Okay. And the bacteria, certain bacteria, bad microbiome, let's call it, probably the most important one is the streptococcus bacteria, strep mutans. And that bacteria is the one that likes to grow on our teeth and colonize on our teeth, which is normal. We want a healthy microbiome in our mouth. The thought of we want to get rid of all the bacteria in the mouth is wrong. We want to groom a healthy bacteria, okay, a healthy environment. But nonetheless, when it's unhealthy, then it leads to an acidic environment. And these bacteria that create acid will basically poop their acid onto the surface of the tooth and start dissolving it and decaying it. So, if we have a healthy microbiome, a healthy mouth, we don't have to worry about decay, because, we have in our saliva, we have the buffering ability, so we need healthy saliva, which again goes back to health. What are you eating? What's going into the tube, and what is the body absorbing to create a healthy saliva? And, and in the saliva are minerals for remineralization, because the surface of the tooth is porous. It's always coming in and coming out.
Dynamic.
And, and nowadays biological dentistry, we look at remineralization strategies. Like if we see beginning breakdown on a tooth, or higher levels of decay, or a small cavity that perhaps another dentist would say that has to be drilled out of your tooth. This dentist says, let's go ahead and flip the switch. Let's go ahead and start controlling the microbiome. Let's get your gums healthy. Let's teach you, the patient, how to control the microbiome in your mouth. Maybe take oral probiotics, because you can actually chew tablets that have the more beneficial bacteria, and and start creating a more healthy population in your mouth. And and those bacteria are being swallowed also. So some of those bacteria in your mouth go down into the gut, down into the tube, and some make it past the stomach acid and into the the small intestine and into the large intestine. So I don't know if that answers your question, but ultimately,
sure, yeah. No, I talk about the gut biome a lot. It's interesting today that I hear that the gut starts, or the biome starts at the lips and the mouth, and that's why I wanted to make that connection with you, the mouth biome and the gut biome, but it's all part of our immune system. Experts say 60 to 80% of our immune system is the gut. Of course, we got our lymphatic system, our spleen, our white blood cells, but 60-80% comes from the gut. And yes, you mentioned probiotics. We need the healthy or the good bacteria. Of course, a lot of medicine, a lot of unhealthy foods, man-made foods, sugary drinks, the man-made foods, I call them, but also antibiotics, of course, destroy those good bacteria. And good bacteria only can colonize in a healthy environment. Otherwise, they can't colonize. And so we also need at least minus 300 millivolts in our gut in order for good bacteria to colonize. And so most of the time, it's much less than that. So when people are not healthy and they swallow, for example, probiotic supplements, some of those may reach the gut, but they can't colonize because the environment is not suited for colonization. So a lot of my clients, I recommend that they drink hydrogen water, because even in 2 weeks drinking hydrogen water, the membrane potential, or the potential of the gut, will go minus 300, minus 400, and that's a suitable environment for those good bacteria to colonize. So there's a lot of things that people can do with the help of people like myself, you are functional medicine doctors, to really get that microbiome in good shape and prevent tooth decay. So I really like that section. Now, what technologies do you use in your office when it comes to this biologic dentistry?
Well, one thing that, one of the tenets of biologic dentistry is minimally invasive dentistry.
Okay.
Okay. And what that basically means is that trying to do as little as you can to fix the problem, right? And so, for example, the pits and fissures that I talked about that are very common when a tooth erupts. The tradition in dentistry is to put a dental sealant on it, which is put on by somebody that was an auxiliary in Florida can put it on, that was trained in a 6-week course, and trying to put that on a tooth that's not cleaned properly. It's a recipe for
disaster,
failure.
it seems.
It's a recipe for failure. And you can imagine just putting a layer of plastic on the chewing surface of the tooth and expecting it to stay there. And even if some of it stays there, some bacteria gets under it, decays.
Yeah.
So I adopted air abrasion, probably 30 years ago, which is a system where we actually clean the surface to the molecular level, and on these teeth that have open pits and fissures, we open those up just a slight bit. If there's decay in there, we take the small amount of decay out, and then we put a preventive resin filling into those grooves, which is somewhat more like a liquid than really a putty. Yeah. And unlike a sealant, this is a much stronger material. And I'm looking at these now because I look at my own kids' teeth. They're now 40, and then they were done 30 and 35 years ago. And these teeth are, they look perfect.
Yeah. So
that's an example of minimally invasive dentistry and the use of air abrasion, which is something that we use on every time in our mouth that we do any procedures. We air abrade the tooth to get the final bond. So whether you're doing a filling or a crown, it's all about the adhesion of those to the tooth. And if it's not if it's got saliva on it, certainly if it's got blood on it,
it's about getting it 100% clean before you seal it or fix it. That's what
100%.
Yes.
It has to be 100%. And and we, in our practice, we work through the surgical microscope, which very few dentists do. Usually the endodontists do, but microscope dentistry has really not taken hold, unfortunately. But with that, we're looking at much higher magnification and better illumination, so we can really see exactly as we're doing it.
What's going on.
So that's one technology that we use that is fairly uncommon in dentistry. I don't know why. I've been using it for a long time, and the two associates at our office, they've totally have bought in and used it themselves.
So the listeners can think of it as just as a magnifier, so you see a lot more detail and can be a lot more effective in cleaning up, whatever's there and doing a restorative job, correct?
Exactly. Yes. Like when I'm doing a crown, which I did a few yesterday, the final fit, the margin, which is exactly where the crown's going to end. I go to a high magnification, 13 power, and I turn the water off,
and I am just polishing the enamel so that it is as perfect as it can be. And then I scan it. And now the scanner sees it perfectly. And most of the time, there's a little bit of gum in the way. So if the gum is in the way, that's a problem.
Yeah.
So we have laser. So we have a laser, and with the laser, we can just trim that gum enough to expose the tooth. And if the gum is a little bit unhealthy, we'll actually trim the gum so that it heals nicely. And the laser is also killing bacteria around the gum. So there's all kinds of benefits of using the laser. And so laser dentistry is something that we do. And, and sometimes we'll use a laser actually on the tooth. Some cavities I'll actually cut the tooth with a laser.
Yeah.
You can trim bone and soft tissue. And the lasers have, biological properties of healing. Besides, they kill bacteria. And so, we use the laser as a common tool that we use in the practice. And probably one of the other technologies that we use is ozone.
Yes.
And ozone is a gas which is made from medical grade oxygen. And it's an unstable compound, and it's very reactive. It's an oxidizer. It's the strongest oxidizer. And that charge, that the two O's become an O3. So you got O2 and then O3. O3 is the ozone, is unstable. And before long, it goes back to O2. Those two O3s get together and say, let's make three O2s. But when you go ahead and use it in the body, that O3 is reactive. And if it sees anything that's foreign, any kind of bacteria, virus, fungus, even a prion, it rips it apart. And then it rips the cell membrane apart. And now that kills that bacteria. The body then takes care of the mess. So ozone also has a lot of upregulation of healing. And, it can actually stimulate healing into the pulp. It can actually, it's a gas, it can diffuse into the pulp and actually help the cells inside of the dental pulp to heal on a very, very deep cavity. I believe that, with some of the biological treatments that we do, can save a deep cavity that otherwise would definitely need to either have a root canal or be extracted. So some of those techniques, can, make a difference, in saving a tooth. The goal is not to get a cavity.
Minimally invasive, not get a cavity. Preventative care, of course. So I see, besides the more biologic compounds that you use, it also seems to be very important that you have the appropriate technology, not just to magnify, but also, to make sure everything's clean. So we talked about the ozone, we talked about the laser, about the airbrush.
Air abrasion, we call it.
Air abrasion. So it's very important to have those tools. And then when I'm listening to you, Dr. Chris, it seems like you need the right person too, like yourself. That's not only that, you guys are artists when it comes to that. And you need to be, I guess, passionate about your work, because we're talking about, and I'm not a handyman, but so you need to have that, what we say, Fingerspitzengefühl. You have to have that, artistic hand to do all this, correct?
Well, something, it's interesting. As a dentist, you are a chemist, you are a biologist, you are an engineer, and you are an artist. Yes. All of those disciplines come into it. And, something, I consider myself blessed that, that I have chosen this profession. And to be honest with you, after 44 years, I'm doing my best work, as good as I've ever done in my career.
Experience counts too, right?
And I'm enjoying doing it. I'm enjoying helping people. But I think that probably the thing that really means the most to me is affecting somebody's life in a way where I help them to get to the root cause of disease in their own mouth.
Yeah.
And educate them as to, why things might be what they are and what they can do differently, and So I have been
that's what real healers do. So that's why I appreciate you, and that's why I'm intrigued with the knowledge that you have. So before we close up, do you have any maybe practical advice for our listeners to start improving their oral health?
Yeah, I guess that, my first advice would be, taking the best care of yourself on a daily basis. And I believe that flossing is probably the most important thing. Okay. And it needs to be done with intention and done properly. And that what I mean by that is that the floss actually curve around the tooth, and then it has to slide all the way under the gum as far as it can go, because there's an area under the gum where the bacteria are living, and that's a normal place.
So
And if we
most
don't
people
clean
won't
that
get
out,
there. Yeah,
that's where that bacteria starts getting worse, and that's where the inflammation in the gums happens. And that fight of your body to try and fight bacteria that it can't get, those bacteria are technically outside the body because they're on the tooth. They're not inside the body. The immune system can't just grab them. And now that becomes now it gets swollen and it starts bleeding, inflammation. Okay. So, flossing is really important. But what happens is that in time, all those bacteria down in that under the gum create, biofilms, and sometimes those can't just be removed by floss. They need to be removed with instrumentation. So, for people to think that, well, I'm just going to start really flossing, and my gums are bleeding a little bit, and I haven't been to the dentist in 7 years, and
so that's where your regular
I hate the dentist. It's hard. And I'll do it next week. I'll make an appointment next week. Right.
So it's the regular. So you're talking about the regular cleanings are essential because you need instrumentation to really get there on a regular basis.
For the 98% of the people, that's exactly the case. And now once you get the mouth healthy and the roots are clean, and you start flossing properly, now the dental cleaning with the hygienist becomes easy. It almost becomes fun instead of painful. And so maintenance is important. And then really good brushing of every surface of every tooth. Okay. And I see everybody brushes their teeth. Well, let's say this: almost everybody brushes their teeth. And I would say this: that almost everybody doesn't get it all.
Yes.
They leave some level of bacteria on the teeth, particularly on the inside of the lower teeth, down where the tongue is fighting the brush, et cetera, and the harder to reach places. And
do you have any recommendation on type of toothbrush and also toothpaste, since we talked about fluoride? Are there recommendations?
Okay. You know what?
Those?
To be honest with you, I do not use fluoridated toothpaste myself.
Me neither.
And I don't recommend it for my patients. Although occasionally with somebody that's got really high decay rate, and Haley, who works with us, is a oral oncologist, and she treats a lot of cancer patients. So sometimes that's in her training, that was fluoride was the important. But ultimately, the answer is, I think a non-fluoridated toothpaste is good. And right now I'm using a product called Risewell, Risewell. You can get it online, and we sell it in our office. And that's a toothpaste that is natural, all good ingredients, and has remineralization component to it. It has xylitol in it.
Yeah.
Which xylitol is something that is something I believe is beneficial. Okay. And to change the oral microbiome, it's a whole nother subject. And it has, hydroxyapatite in it, which is the minerals
original
that go back into the tooth.
Yes.
And it's interesting that we've done studies. Studies have been done on the scanning electron photomicrographs, and show that when fluoride is introduced onto a tooth, it creates almost just a skin on the surface. It doesn't really penetrate into the enamel like the minerals would.
Yes.
So, it's even showing that, fluoride treatments, which we don't do in our practice, okay, which is sort of traditional, that a child would go in and have fluoride placed on their teeth, and that, that those children are getting some of that fluoride. And, of course, make sure you spit it out. As a matter of fact, if you read the label on a toothpaste, the fluoridated toothpaste, it tells you if the child takes too much of it, call poison control.
Yeah.
Right.
Yeah. There it is. Right. You don't have to believe us. There it is.
Yeah, right. It's a warning on the side of the toothpaste label, right? So I don't believe that fluoridated toothpaste is necessary, but I tend to think that there is research, that has been done in dentistry that shows that topical application of fluoride can have some benefit. Technically, I think the fluoride kills bacteria because it's a toxin.
The toxin, yes.
Well, we don't talk about that, but ultimately, I think that's one of its modes of action. So, and as far as brushing, I think that the Sonicare toothbrush is probably the tool that can do the best plaque control.
And are we talking about an electrical toothbrush now?
Well, the Sonicare it works by vibration.
Okay.
And so it vibrates
Loosens it up.
at high frequency, and you don't scrub with it. You sort of hold it in place and slowly move it. And if you push it hard enough against the tooth and the gum, the bristles are soft. Now the bristles can get in between the teeth and under the gum, and and can really clean that crucial area, because that's where the damage all happens, and that's where people miss. People brush the top of their teeth, which don't even need to be brushed, because the food,
because they're fine. Yeah.
The food cleans the tooth there, and yes. they brush what they can see, and I would say using less as opposed to more toothpaste. You don't want a mouthful of foam. I use the size of a pea is what I use on my toothbrush.
All right. Well, all very good practical tips. Any more something that's on your mind that you want to share before we finish this great podcast?
Well, I tend to think that hopefully this has inspired people to think about health.
Yeah.
And more than just teeth, and and that there's so much that we are all connected. Every cell is connected in your bodies, and so I would think that thinking about holistic health in general is really important. Diet, and obviously the more sugar that we incorporate into the mouth, the more the acid, the more the decay. So
all the
I would
acidity
say
we talked about. Yeah.
Don't drink Mountain Dew, right? And don't eat
sodas,
donuts.
no coffee.
Well, no. I think black coffee without sugar in it, I think it's probably fine.
It's still acidic, but yes.
Yeah, I don't think that acidity is a kind of acid that is going to be a problem. I think that goes in and down the tube. So
it doesn't stick in your mouth.
We're concerned about the bacteria, the biofilm on the teeth that's creating the acidity. And then of course if you add a drink like Coke, which is a pH of like 1.5 or 2, or Mountain Dew, which is like 1 point something.
Yes.
You've got more acidity plus plenty of sugar in there for the bacteria to
colonize the bad
to eat
ones.
and process and create the acid. So I think that overall health, and I think that finding a biological dentist is a good idea. And again, I recommend it to go to the IAOMT.
So is that the website?
I think if you just Google that, it'll come up.
Okay.
It's not IAOMT.com. And to learn more about fluoride, I would go to the Fluoride Action Network.
Action Network.
I'm trying to think of what the website on that one is.
We can Google it, and I can post the links.
That's a good link there.
Yeah.
And our website, has some good information on it about the way that we practice dentistry.
So let's share how people can reach you, Dr. Chris.
Yes. Well, I practice at the Smile Design and Wellness Center in Vieira, Florida. And there are 3 dentists there, and we have 4 different hygienists. And we're all practice in a very biological way. And we are accepting new patients. I'm there only part-time, at this point here, after 44 years, I'm taking some time off, but the other dentists are very competent and caring, and will do really good service.
So what is your website?
And the website is Smile Design Center, all one word, .us.
SmileDesignCenter.us
is our website. And and I wish people, the best health, and really looking at all the components that go into that, and realizing how important the mouth is as the start of the gut, and the importance of the microbiome, and grooming a healthy microbiome in your mouth.
Yeah, well, that was a great lesson, even for me. I learned a lot today. I appreciate your knowledge and sharing your knowledge. I appreciate your time. And thanks for being on, Dr. Chris.
It's been my pleasure. And, it's always sort of fun. And sometimes I get a little bit passionate. So, and I use my hands. So,
that's
sorry
good.
about that.
Yes,
And,
we need to be passionate.
it's been, and I want to shout out to you, for you to be doing a podcast for the greater good is fantastic. I mean, that's part of what I think